If anxiety shows up in your body, tight chest, racing heart, shaky hands, this video will explain what actually is happening. A lot of anxiety isn't a mindset problem, it's a nervous system pattern. In the next few minutes, you'll understand what anxiety is, why it can feel so intense, and what we look at first. Quick note, this is educational, not medical advice. Before we get into anything else, I need you to hear this clearly. You're not weak. You're not broken. Your system is trying to protect you. It's just stuck on high alert. When your heart is racing and you feel like you can't breathe, your nervous system is doing exactly what it's designed to do. It just can't figure out how to turn off the alarm. I want to tell you about someone who changed how I think about this completely. She was a special education teacher, someone who had been a longtime practice member here. One day she came in and told me that she was barely hanging on. She's having 12 to 15 panic attacks every single day. She had been through what she called the gauntlet: therapy, medication, different techniques. Some things helped a little, but nothing really changed the baseline. And to be honest with you, when she asked about neurofeedback, I was newer to it and I wasn't sure how much it would help. But I'd seen the research and I'd heard about the outcomes that were hard to ignore. And we had an honest conversation and decided, let's try this. After about 20 sessions of neurofeedback, along with other nervous system support we use here, she told us those daily panic attacks had become almost completely gone. She kept going with sessions to reinforce what her brain had learned. More than 10 years later, she tells me that the panic attacks never came back. She still teaches special ed, one of the most demanding jobs there is, but her system doesn't tip into that same spiral anymore. Her job feels manageable again. This isn't everybody's exact experience, but it's a good example of what can happen when we stop guessing and start measuring what's actually driving the pattern. So what is the pattern? What is anxiety really? Anxiety is often your brain and your nervous system stuck in danger mode, even when you logically know you're safe. Your thinking brain might say, I know this isn't a big deal, but your body is screaming, we're not okay. That is why you can't think your way out of it in the moment. You can't outlogic a full body alarm signal. You can't mindset your way out of a physiological response that's already firing. Here's exactly how this loop works. And once you see it, you can't unsee it. First, your brain senses a threat. It could be a real stress. It could be a memory. It could be an overwhelm that's been building. Sometimes your system has just been on high alert for so long, it's hypersensitive. Then your body gets the stress response: heart pounding, breathing changes, tight chest, tense muscles, stomach flipping. Those sensations feel scary. And here's the key: your brain notices them and thinks, something's wrong. I feel terrible. This must be dangerous. So your brain reads those sensations as more danger and then fires another stress response. The loop repeats: brain, body, back to the brain. This can start from chronic stress, poor sleep, trauma, overwhelm, or a system that's been in survival mode for months or even years. That's why your reaction can feel completely out of proportion to what's happening around you. You're not overreacting on purpose. Your alarm system has become oversensitive. Now, I want to be clear about something. Coping tools matter. Breathing exercises, mindfulness, therapy, grounding techniques, these are genuinely valuable, and they help you manage the moment when the alarm is going off. But here's the honest truth. If the system is stuck in an overactive loop, we have to work on the pattern underneath, not just the flare-ups on top. That is why you can do everything right and still feel stuck. It's like having a smoke alarm that keeps going off even when there's no fire. You can get better at dealing with the beeping, but at some point, you have to take a look at why the alarm keeps firing in the first place. That's the difference between coping with the pattern and actually changing it. That's why our first step is measurement. We want to understand how the brain and the nervous system are actually functioning instead of guessing. From there, the plan may include neurofeedback to help the brain practice calmer patterns, gentle KST chiropractic care to help the nervous system feel safer, and support for the body's foundations like nutrition and lifestyle when needed. The goal is to help the system learn how to shift out of the high, constant state of alert so your coping tools actually have something solid to stand on. Most places do one piece. We connect the whole system. If your anxiety feels physical and out of proportion, you're exactly who this series is for. Because if you're wondering what this actually looks like, I'll walk you through it step by step so it feels familiar before you even come in. Go watch that next. I'll see you there.